August, Barack Obama's health care drive took a beating.
You just don't get it!
But now it's September. Congress is back after those stormy town meetings, and the president says it's time to bring a sometimes angry debate to a close.
And that's why it's time to do what's right for America's working families and put aside partisanship, stop saying things that aren't true, come together as a nation, pass health insurance reform now, this year.
That's why he's relaunching his drive with a speech that's got all the trappings of a State of the Union address. 16 years ago, Bill Clinton went to Congress the same way, but his bid collapsed. How will Obama's speech differ?
That was the beginning of a healthcare process rather than what we see as, quite frankly, close to the end.
And top Democrats insist accord on a sweeping overhaul is tantalizingly close.
We think we're up to 90% of things that are agreed upon. We have 10% that we need to work on, and we can do that.
Yet during August, poll support for Obama's drive slumped, and Republicans turned up the heat even more.
This government-run health care plan will have the competence of FEMA, the efficiency of the post office, and the compassion of the IRS.
A key flashpoint's been the so-called public option, a government insurance plan Obama would offer those without coverage.
He believes that the public option is the best way to keep the insurance companies honest and to increase competition.
Yet it's doubtful the option can pass the Senate. Even moderate Democrats are balking, and Obama is not insisting.
There's not a rigidity. He's focused on the end, and he's focused on results.
One possible compromise, a trigger launching the public option if private insurance companies can't or won't step up.
What's clear is that the president's got work to do if he's to assemble a plan that can win bipartisan support. Of course, he and top Democrats could simply sidestep GOP opposition and push through a plan using simplified budget rules. But that's often called the nuclear option, and it's one Obama and top aides urgently want to avoid. Mark Smith, The Associated Press, the White House.